Hello everyone, I'm Oliver Supasinga with USAID's Water Office in Washington, D.C. Welcome to today's webinar, where we'll be presenting findings from the ExPost evaluation of the Millennium Water Alliance-Ethiopia program, which has worked to improve water, sanitation, hygiene access, and local capacity in the country since 2004. Today you'll hear about key findings from the soon-to-be-released ExPost evaluation of the MWA-Ethiopia program's work between 2004 and 2009, which was located in 24 rural woredas, or districts of Ethiopia, and the extent of which the MWA program outcomes have been sustained and the factors affecting sustainability. Our presenters today are Carrie Nelson, a Senior Technical Specialist at Social Impact, who will present evaluation findings on the long-term outcomes related to rural water point construction and rehabilitation, community management of these water points, as well as sanitation and hygiene education activities. We're also joined today by my colleague and moderator for this webinar, Elizabeth Jordan. Liz is a Water and Sanitation Advisor in USAID's Water Office. She will moderate today's webinar discussion and Q&A and give us a little background on how this particular evaluation fits into our series of ExPost evaluations. Just some housekeeping issues real quick. You can submit questions at any time during the presentation in the chat box on the left of your screen, down right about there, about halfway down. But questions will not be answered until the end of Carrie's presentation. If you're having any technical issues during this webinar, please let us know in the chat box, and we'll do our best to resolve them. Also below that chat box, you can see there's a little space where you can actually download today's presentation and also a brief overview of the evaluation and its findings. So that should be helpful as well. I do need to let you know that today we are recording this webinar, and we'll be sharing it next week. You can find the slides again below in that little box. The full program evaluation and brief will be finalized soon, and all these resources will be shared on USAID's Water Sector Knowledge Hub, globalwaters.org. Now I'd like to turn things over to my colleague Liz Jordan, who will tell you a little bit more about our overall ExPost evaluation series, and introduce Carrie.
Great, thank you, Oliver. And thanks everyone for joining us today. I hope you all find this valuable and take a look at the handout with the executive summary of the report. Findings will be coming soon. So USAID is committed to understanding more about the sustainability of our interventions and learning about how we can make sure that our programs result in outcomes that last well beyond the life of the project. As part of this commitment, we're implementing this ExPost evaluation series, which is aimed at understanding whether outcomes are sustained beyond the life of a project, and very importantly, why or why not, so that we can continually improve our programming and improve sustainability. We're looking at projects that were closed anywhere from 3 to 10 years ago, preferably in areas where there hasn't been follow-on activities and continued donor engagement, so that we can really understand whether the host countries and the local communities have been able to sustain the outcomes without donor interventions. This is planned to be a series of 6 evaluations, spread out geographically and also covering a wide variety of the types of interventions we work in within WASH. So today you're hearing the findings from the Ethiopia evaluation. We've completed evaluations to date in Madagascar, which focused on rural sanitation and hygiene outcomes, and Indonesia, where we focused more on the utility strengthening and governance work under the ESP program. The full reports and briefs for both of those evaluations are available on USAID's globalwaters.org website. I also want to put a plug in that at the end of June, we'll be doing a webinar to present some of the Indonesia findings. So hopefully you'll be able to tune in for that. And at the end of the series of 6, we intend to do a synthesis report that really brings together themes across all of these evaluations that we should be looking into to further improve our programming. So with that, I'll hand it over to Carrie, who's going to present on the specific Ethiopia findings.
Great. Thank you very much, Liz. And thank you to everyone who's on the line and participating in today's webinar. I look forward to sharing with you what we've found from this very interesting evaluation. Just to start off with a brief overview of what we'll talk about today. So first, I'll give a little bit of the background on the activity itself. I'll walk through our evaluation design, and then I'll really dig into the findings and really kind of explore some of the themes that we found, as well as the recommendations, ultimately, that we arrived at. And then, as Oliver mentioned, there'll be some time at the end for some questions and answers. So the Millennium Water Alliance-Ethiopia program was implemented with clearly the Millennium Water Alliance, but with the partnership of 8 different implementing partners. The overall funding for the program was around $7 million, and it was implemented from 2004 to 2009. So we are looking at a project that was in the area of about 10 years ago. There were 4 overall objectives of this activity. 1, increasing the level of access, decreasing the prevalence of water and sanitation related diseases, the promotion of integrated water resource management, as well as developing a partnership model for service delivery and advocacy. Now, this ex-post evaluation focuses primarily on the first of these outcomes, looking at the level of access and behavior change around sanitation and hand washing. In terms of the key achievements from this activity, so they constructed or rehabilitated 505 water schemes, as well as established and trained washcos for each of these water points. And so the washcos are community management entities to manage the water schemes. On the sanitation side, they supported over 30,000 household latrines. They supported over 180 public latrines, as well as over 90 school latrines. Now, I do want to note on this last point, we did not include the institutional component, the school latrines, within this evaluation. On the hygiene side, the activity provided hygiene and sanitation education for over 300,000 people. In terms of our evaluation design, we had 6 key research questions. So on the water side, we looked at access and the varying levels of service at the water schemes. We looked at use of the water schemes, and then also the management and maintenance of those water schemes. On the sanitation and hygiene side, we looked at kind of the current status and what the different factors were in the use and practices. And then we looked at, for the public latrines, we looked at the management structures that had been put into place and how those were functioning. And then ultimately we looked at the questions of why, really what was driving sustainability and what some of the barriers may have been. In terms of our data collection methods, in order to really dig into some of these why questions, this was a primarily qualitative study. And so we did 64 interviews with a wide variety of different actors to make sure that we really got the different perspectives in our research. And so we talked to the implementing partners, we talked to regional ministries, health extension workers, the latrine owners, the washcos, the management structures, as well as water users. And then we also had direct observations. We looked at the household latrines, where there was 15 of those, and then we looked at 13 water schemes. And where the water schemes were functioning, we also did water quality tests. We also, in order to supplement these data, we also collected all available secondary data. One of the key data points or data sources that we were able to collect was a water point inventory that represented all of the water points in the South Gondar zone of Amhara. And basically this data set included 4 of the activity woredas and included 54 activity water points as well as over 4,000 non-activity water points. So this was a very useful data point for us to use for comparison purposes. Now I do want to include the caveat that this is not a formal comparison group. It's not an impact evaluation, but it was a very useful data point for for comparing with our results and adding additional rear to our study. We also included hygiene and sanitation data in the Farta and Samata woredas. In terms of our evaluation sites, we included 3 woredas in the Amhara region. You'll see those in the dark gray towards the north, and then down in the SNNP, where we visited 4 woredas. So jumping into the findings, just as a point of order, I'm going to walk through kind of the current status and use. And then I'll dig into, at the end, the different factors that were kind of driving or potentially inhibiting sustainability. So on the functionality side of the water points, of the 13 sites we visited, 5 were fully functional. An additional 5 were what we considered partially functioning, and then the remaining 3 were not functioning at all. And here we used a basic definition of the ability of a water point to produce water, with the non-functioning water points not being able to produce anything, the partially functioning sites being able to produce some water, but substantially less than they were initially designed, and then the fully functioning ones, as you might guess, were those that were able to produce water as they were intended. We noted that none of the livestock drinking troughs or washing basins were functional at the time of our visit. Now, not all of the sites had those. That was not part of the activity design to have those at all of the sites, but at the sites where they did have them, none of them were functioning in the ones that we visited. In addition to the data that we collected directly, we do also have some functionality data from the Amhara inventory, where they used a somewhat similar definition of functionality without the partially functioning distinction. So they basically just looked at whether the water point was able to produce water at the time of their visit. And here we found that 44% of the MWA-EP water points were functional, as compared to 68% of the water points overall. And here, given it's been 10 or so years since MWA-EP was implemented, you might be curious to understand the extent to which age might be playing into that, and so we did examine that. However, we saw a similar trend both through regression analyses as well as kind of comparing those sites that were built in a similar era as the MWA-EP sites, and found a similar trend where the MWA-EP sites were underperforming the non-MWA-EP sites. In terms of the quantity of water, based on flow rates, we did find that theoretically all the water points that were at least partially functioning could produce the 20 liters per person a day based on their intended user area. Which varied pretty significantly between around 30 households at the smallest size, and then our largest one, which was a pretty big outlier at about 700 households. Most were, all but the one was under 200 households, but we had one outlier, actually the one you can see in this picture here, that was supposed to serve 700 households. In speaking with users, people did note that they were able to meet their water needs. However, in doing so, most people were relying on multiple water points and not just the MWA water points. In terms of quality, we found that only one of the water points was tested regularly. All of the others were tested perhaps sporadically, and in a couple cases, people noted that it had not been tested since it had actually been constructed. When we asked people if they thought the water was safe to drink, most people said yes. And in talking about that, they primarily referred to visible cleanliness. It didn't have debris in it. They knew that animals couldn't get to the water source, that they were covered water sources, and that the water was clear. However, through our water quality testing, 7 of the 10 sites we found actually were contaminated with E. coli. In terms of chemical contamination, there's only one site in SNNP that was above the norm for fluoride, and none of the sites tested positive for arsenic. In terms of reliability, there was a need for repairs at most of the sites. This is likely not very surprising considering the age of the water points. And so overall, we noted that in terms of reliability, though some seasonal fluctuations occurred at a few of the sites, the issues were primarily mechanical rather than seasonal. Looking at accessibility, both in talking to people about how long they thought it took them to gather their water every day, as well as extrapolating out based on how many people were waiting at the water points and the fill times, we estimate that wait and travel times are likely still over 30 minutes at the sites. Thus, accessibility is still a challenge at these sites. In addition, we also looked at potential handicap accessibility and found that none of the water points were accessible for those with disabilities. Most had stairs and or had other obstacles. As you see in this picture here, at this water point, the fence was actually falling down, and so there's actually barbed wire that people had to walk over in order to actually access the water point. Now, I do want to point out this was not an intention of the MWA-EP activity. That wasn't a stated goal to make them handicap accessible, but it is something that we examined as a factor of accessibility in our evaluation. And then looking at use of the water points, so the water points were typically used daily when they were functioning, so they were being used regularly. In terms of what they were being used for, the MWA water points were most frequently used for drinking water. And then the other sources, since most people were relying on multiple sources, those were used for a wider variety of needs. In a few cases, people did say drinking water, but they were also talking about for washing, for cooking, as well as for their animals. In terms of who is able to use the water points, across the board, people said that everyone in the communities were able to use the water points, that there weren't significant restrictions or there weren't particular segments of the communities that were kind of either prohibited or otherwise restricted from accessing it. There were a couple exceptions. In a couple communities, people said those who owned their own water point did not use the MWA water point. So if somebody had actually constructed a well or other water point on their own property, they then did not use the MWA water points. And in only a few cases, we heard that people who do not pay their fees are prevented from using the water. In all other cases, it appeared that people, even if they didn't pay the water fees, were still able to access water. Moving on to the latrines. So for the household latrines, we found that most of the MWA latrines had been replaced. Being it's been around 10 years, that's not surprising that the latrines would have filled up and needed to be replaced. And so we did find that most of them had been replaced. However, most of them still were not improved latrines. They were more along the lines of the picture that you see here. So ultimately, we found that owners were not really moving up the sanitation ladder. In terms of use of the latrines, when we asked people how often they used the latrines, they said all the time. Everyone in the family, all the time. And we suspect there may be some positive response bias involved in those responses, that people know that they're supposed to be using the latrines, and so they're giving the quote-unquote right answer. So that's why we purposefully included other data points with which we could triangulate those individual responses. And so there are additional data that suggests that maybe latrine usage isn't quite as high as people are reporting. So through our direct observations, 5 of the 15 had no signs of use. So for example, actually the latrine that you can see in this picture, the hole was actually completely covered with cobwebs. It was very clear that no one had used this latrine in quite a while. And also in talking with the health extension workers, they also noted challenges and kind of noting that, yeah, sometimes people use the latrines, they'll use it when it's convenient, but if it's not convenient or other things are going on, sometimes they just don't. And so they noted some of those challenges in really convincing people to use them all the time. In looking at potential gender age distinctions for the latrines, we did not find any such distinction. So there weren't men's latrines versus women's latrines at the household level. Moving on to the public latrines, unfortunately, none of these still existed. They had been dismantled over time for firewood and then had fallen into disrepair, and so today there's actually nothing remaining. So we weren't actually able to do any observations. We were only able to talk to the health workers in the area. Looking at hand washing, similar to what we found with the latrines, people report that they always wash their hands. Again, we suspect there may be some positive response bias playing in there, especially as we noted in the observations that there were no hand washing stations at any of the latrines, and nor did we see any other signs of hand washing, things like soap or a bottle of water, things like this, water spots near the latrine, things like that. And again, in talking to the health workers, they also reported challenges in changing behaviors and really convincing people that this really would benefit them and that they really should be engaging in these practices. So now moving on to the question of why. What are the factors that are influencing what we saw in the current status? So looking at the water points in terms of water point maintenance and repair, as I noted, a lot of the water points had needed to be repaired over time. Not particularly surprising, but one of the things that we did find is that while the washcos had been able to repair most of the minor repairs, a lot of the major repairs they were unable to do. And the biggest challenges that they faced, really the biggest one was lack of money, by far and away. That was the main reason that especially the major repairs had not yet occurred. Either they didn't have enough money to do the repair entirely themselves, or they didn't even have enough money for the community contribution that is typically required for them to go through the water offices and have the water points repaired. And so in that case, they would just stay broken, basically. Other challenges that people noted, these were noted to a much lesser extent, but they were noted as challenges in a few cases, was difficulty obtaining parts, as well as a lack of technical capacity for particular repairs. But again, these were noted in just a handful of cases as compared to the money issue, which really seemed more central. In terms of overall washco performance, communities thought that overall performance could be improved, particularly around maintenance and repair. And given the number of repair issues and functionality issues we saw, that's perhaps unsurprising. We do have, in addition to the data we collected directly, there was also some washco performance data in the MHARA inventory. So here we found that 45% of the MWA water points had a fully functioning washco as compared to non-MWA water points, which was at 61%. And here they defined a fully functioning washco as having 7 active members. And again, even when we adjusted for the age of the MWA water points, we still saw the same trend. Looking at the public latrines, unfortunately, we don't have very much information about what the management plans were, whether there was some kind of management committee that was put in place or what exactly those plans were. But given the latrines no longer exist, we can assume that they were unsuccessful. Moving on to the financial factors. So for the washcos, 7 of the 13 had collected fees at some point. The remaining had not. And when the washcos were collecting fees, most reported high fee recovery rates, that they were actually able to collect the fees that they were expecting. However, the fees themselves are generally quite low. And so they most commonly range between about 10 and 25 birr, which, as a point of reference, the current exchange rate is about 27 birr to the dollar, so we're talking about less than $1 per year for a household to access the water points. And so just the total amount of money that the washcos were able to collect, even when they were collecting, just was not sufficient. We do find that fee collection and recovery rates are linked to higher functionality. If you look at the chart on the bottom right here, you'll see that those that had never collected any fees, most of those water points, 3 of the 4, are in the non-functioning category. Whereas when you look at those that had at least collected water fees while the water point was still functioning, they're mostly functioning or at least partially functioning. The biggest challenges washcos said they faced in collecting water fees was poverty of the people in the general communities, but also conflict among water users. And while a few different types of conflicts were occurring, one of the main ones was conflicts between those who were paying their water fees and those who did not pay their water fees. Understandably, the folks who were paying their water fees were upset, as I noted before, in a lot of cases, those who were not paying were still able to access water. Well, that was making some of the people who were paying their water fees upset, that those who didn't pay could still access the water. Here, in addition to the site visits that we did, we do also have some data from that MHARA inventory, where we find that fewer of the MWA washcos had a maintenance budget as compared to the non-MWA water points. Again, I will emphasize this isn't a true comparison group in the impact evaluation sense, and it does only represent one of the zones in the overall activity, but it does kind of add an additional data point for our research. In terms of fee collection, we did find that this varied significantly by region as well as by woreda. So for instance, in SNNP, the washcos appeared to have a easier time, not an easy time, mind you, but an easier time collecting water fees. That it was much more likely that the washcos were collecting water fees. Whereas up in MHARA, there were a number of cases where they had never collected fees at all. And then even within the regions, there were variations between the different woredas. So for instance, in the Somata woreda that we visited, when we talked to some of the folks, they actually kind of laughed at us when we asked if they were paying for the water. They're like, why would I pay for water? That's crazy. Water's free. Water should always be free. Why would I pay for it? But then in a woreda like Dera, which is in the same zone, everyone that we talked to was paying for their water, and we didn't quite get that same kind of surprised reaction, like, why on earth would I do this? And so there were kind of these variations, and so we tried to look into what's driving these regional variations. And so now we don't have an impact evaluation with different treatment arms that we'd really need to be able to test the extent to which each of these factors is influencing fee collection. However, some of the factors that we were able to tease out were just historical experience with paying for water. So we have some data on where in Ethiopia people were paying for water at the time MWA-EP was just getting going. And we found that while some of the areas in SNNP were collecting water fees at that time, none of the areas in MHARA were. And so there was just kind of that extra jump of getting people familiar with just kind of the concept of having to pay for water. One of the other things that we looked at was also general availability of water, both groundwater as well as surface water. And so in MHARA, water is relatively plentiful. There's a number of streams, natural springs, that type of thing. And so if people are able to go to natural sources, it may not be as surprising that they wouldn't want to have to pay for water when they could otherwise get it for free. And then when you look at the same map and look at the SNNP area, you see the availability is much more varied. While in some cases it is more available, in other cases it's much harder to access water. And so it may not be surprising that people are more disposed to be able to be willing to pay for the water. An additional factor that could be intervening here is also the different implementing partners. So each of the implementing partners had a slightly different implementation plan. And so in MHAR, for instance, across the 3 woredas we visited, each was implemented by a different implementing partner. And so there could be differences in the activity implementation that are affecting some of these water fee collection differences that we're noting. Moving on to life cycle costs, so given the small amount of fees that the washcos were collecting, we do find that none of the washcos felt that they could cover all of their life cycle costs. And none of the washcos had a detailed budget where they'd actually charted out their different expenses, what they might expect to have to pay, and then comparing that with the receipts that they were getting. Here again, we have some additional data from that MHARA inventory, where we found that fewer of the MWA washcos than non-activity washcos could cover their expenses. This was 6% of the MWA washcos compared to 19% of the non-MWA washcos. And I do want to note that these are low percentages just to start off with. We do find in the literature in general that maintaining the water points in the long term is challenging, and so I think we see this in the data, but it is still interesting to note that the MWA water points were even a bit lower than the average. Looking at latrines and hand washing, as I noted before, for the public latrines, unfortunately we don't have a lot of information on what the financial plans were, if there were user fees or what those structures looked like, but given their non-existence at this point, we assume that they were unsuccessful. Something else that arose in a lot of our interviews is that when water is expensive, sanitation and hygiene uses of water often are not priorities. The people focus more on cleaning and cooking and drinking water than on sanitation and hygiene uses of water. Moving on to some of the institutional factors, in the final evaluation that was conducted in 2008, they found that government engagement in the activity was a weakness, and they kind of predicted that this might affect long-term sustainability. And I think we do find that playing out a bit. So we found that while the rules for hygiene and sanitation support were pretty clear, and everyone agreed that it was the health ministries that were responsible for hygiene and sanitation aspects. On the water point support, we found widely varying reports of who was responsible for what. So who was responsible for water quality testing? Who was responsible for repairs? And even when you talk to when we talk to water offices, for instance, we still got varying reports of whether it was the washco's responsibility, whether it was the water office's responsibility, and in a number of cases, it was actually said that NGOs were responsible for supporting the water points. And so there was just a lot of variation and a lack of clarity around those roles and responsibilities. We also found poor and inconsistent support from the woreda water offices to the washcos. And so this kind of plays into some of the water quality testing issues that we noted, as well as ongoing training and just general support that the washcos receive. Now, the woreda water offices and health offices do experience a number of challenges in providing the support that they're supposed to be giving. One is insufficient budgets, having enough money, for instance, for the water quality testing equipment. Also having insufficient staff. In in a lot of cases, the Woreda water offices might have a handful of staff, and they're covering an area where there are a few thousand, perhaps 1,000 or 2,000 water points that they need to cover. And they just don't have the manpower that's necessary to adequately do that. They also have a lack of transportation and poor accessibility considerations. As one concrete example from our visit, one of the sites we visited first was a 45-minute, pretty rough ride from the main road, and then from as far as you could go on that kind of side road, it was another hour-and-a-half hike to the actual water point. And so, as you can imagine, if you don't even have a vehicle, accessing a site like that would be very challenging. On the health side, we also found that so there's a number of health themes that the health extension workers are in charge of conveying and teaching their communities about. Things like malaria, maternal and child health, as well as the WASH themes. And one of the things that was noted to us in the interviews is that the government actually prioritizes some of those other health themes over the WASH themes. And so some of the WASH themes don't get as much airtime, so to speak, as the other themes. Moving on to technical factors, we didn't really find that technical factors played a huge role. As I noted before, the need for repairs is unsurprising given the age of these water points. And so we didn't find that technical factors seem to be playing a significant role. We did find that land tenure issues were playing a role in at least some of the water points. Now, we don't have any information on how MWA-EP dealt with land tenure issues, but they did come up in our interviews, and they came up in kind of three particular areas. So the first was in site selection and compensation, and so how do you deal with whoever owns the land where you're building a community water point? What kind of compensation do they get? Are people going to be jealous of that compensation? How are you going to deal with those types of conflicts? In one case, it actually conflicts with the landowner, and disagreements about him having gotten per diem for participating in training actually led to the degradation of the water point, and that one actually broke not long after it was constructed, within a few years. The second type of issue that was noted was one that's a bit more relevant for more urban areas as well as prairie urban areas. So now MWA-EP was primarily rural. However, there were a few peri-urban areas, and so it was in this context that one of the IPs noted that the incentives, or really disincentives, for investing in WASH infrastructure were a challenge to convincing people to invest. And so basically what they found is that for tenants, when you don't own the property and maybe you're not going to live at a particular place for a long time, are you really going to invest the significant amount of money it's going to take to build a latrine or bring a water tap into the compound? And even if you wanted to, would you even have the right to? Would your landlord actually allow you to? And then for the landlord side, sometimes there's disincentives if people aren't actually willing to pay more if they have a latrine or if they have a water access point within the compound. And so there's a disincentive for them to invest if they can't recoup those costs. And then the third type of land tenure issue that we saw arise was in water access rights. So now most of the water schemes that were constructed were single point water schemes. However, there were a few extension systems. It arose on one of the extension systems where the water source was over in one location and then the water points were a few kilometers away. And one of the landowners who lived in the middle, where the distribution pipe was passing through his land, he could neither access water at the source nor at the water points, because both were too far away. And he would get upset about this, and he would actually break the distribution pipe so that he could gain access, But as you can imagine, that would cause problems down the line for the actual water points. And so that came up as an issue as well. Looking at the social and behavioral factors, so looking at the final evaluation, they found that the behavior change plans were pretty poorly defined, and that there was significant variation by IPs. And so basically they found that while each of the implementing partners was implementing their own best practices and based on their own experience, there wasn't a concerted effort to learn from the overall WASH literature and WASH experience to have a concerted and agreed upon plan for how to approach behavior change. And when we asked people what the key barriers to adopting better practices were, the number one response we got was a lack of information. Now, in talking to people and kind of exploring this issue a bit, it's not really the base knowledge that's missing. It's not that they don't know what a latrine is, or they don't know that hand washing is a practice that they should be doing. As we noted before, we think there is some positive response bias that was affecting some of our data, and so we do think people have kind of that base knowledge, and so rather it's kind of that next step. It's partly the internalization of that. Do they really believe that washing their hands will make them healthier, and do they really take that next step of putting knowledge into action? And so it's really that kind of next step. It's not the base knowledge, it's kind of that next step into action that remains a barrier. Additional barriers were also norms and tradition. The health extension workers would talk about how people would kind of refute their education efforts by saying, well, you know, my grandparents didn't have a latrine, my parents didn't have a latrine, they were fine, why do I need to use a latrine? I don't think that's necessary. And so they really kind of struggled to combat some of those kind of traditional practices and traditional thoughts. One of the things that people thought could help to improve uptake of better behaviors was sustained messaging and or follow-up. And this has some support in the literature. However, I do want to note that for it to be sustainable, this would be a likely role for the government of Ethiopia to take on, that this would not be a long-term role for donors to play. Looking now at the recommendations that come out of our findings, so the first was to help position government entities to play a stronger role in sustained maintenance and oversight. And so this kind of goes to that lack of clarity around roles and responsibilities, as well as helping to alleviate barriers to providing service and supporting the government to better kind of take up its role. The second recommendation is to examine alternative approaches to improve upon the rural community water management model. As I noted, while this was a challenge for MWA-EP, it has been a challenge more broadly as well for community-managed water infrastructure. That long-term maintenance is a significant problem. And so future projects should really take all of the existing learning as well as new potential ideas of new models into account when planning a new project. The third one is to account for life cycle costs when planning for water infrastructure and tariff setting. I don't think this one is terribly new, but it does continue to pose a problem, and it is difficult to really achieve. You know, there's certainly barriers to being able to collect full life cycle costs. But really, if the infrastructure is expected to be sustainable in the longer term, it really is necessary for whoever is responsible for repairs, whether it's a WashCo or other management entity, or if it's a government entity who is supporting the water points, for whoever that entity is, to have tariffs and other funding sources that will cover those life cycle costs. Number 4 is to assess the suite of water needs and sources when designing new water access projects. And basically this is aimed at making sure that that these needs are properly planned for and that they don't eventually pose an issue to sustainability down the road. Number 5 is to seek stronger, more consistent alternatives to simple education-based behavior change approaches in areas with poor sanitation and hygiene norms. So as I noted, one of the challenges for MWA-EP is that they didn't have a consistent approach. It was also an approach primarily based on the FAST approach, which I think just as a sector, given this activity was implemented 10 or so years ago, practices have evolved since then. And so this recommendation is really geared towards making sure that new activities can learn from all of the existing lessons learned, best practices, etc., so that future activities can really benefit from the existing knowledge. Number 6 is to improve people's understanding and appreciation of water quality. So this goes to kind of that discrepancy between what people thought about the cleanliness of the water and then the actual contamination that we found. And so making sure that people have an appreciation both for the visible types of contamination, but also those that aren't visible. And then finally, number 7 is to address land tenure issues during activity design and throughout implementation. To make sure that there's a concerted plan for how those issues are going to be dealt with, how conflicts are going to be either mediated or prevented, and preventing those issues from posing a problem down the road. With that, that concludes our summary of our findings and recommendations, and so now I will turn it over to Liz to go through some of your questions. Hi, Liz. I don't think that we can hear you.
Oh, 1 second, everyone. I think we're having some audio difficulties with Liz's connection.
Great. Can you all hear me now?
Yes. Great.
Great. Thanks so much for that, Carrie. We had quite a number of questions come into the chat window as you were speaking, but please, everyone, please continue adding questions, anything you'd like Carrie to touch on. We have about 35 minutes or so for questions, so we should be able to address a lot of these. The first question that came in actually was directed at me from Susan Davis on how USAID decided which programs to do ex-post evaluations on. So thanks for that. We looked really to get a variety of types of programs. We set certain parameters around the size of the investment because we wanted to make sure we were looking back at some of our bigger investments. We didn't want to look at where we had just done a small wash piece inside a larger program. We were also looking for programs that had been closed anywhere from 3 to 10 years ago, which is a pretty wide range, but we wanted to ensure that we had at least enough time to sort of see the downstream effect. And then we also look to get a variety of rural and urban programming, since those are both areas that we've invested in. And we also wanted to make sure we touched on some water supply and sanitation and hygiene pieces and get as much of a geographic dispersal as we could. We also, to some degree, prioritized countries where we're continuing to make large investments. So, for example, Ethiopia and Indonesia are both priority countries under our water strategy and water and development plan. So those were important for us to continue to evaluate. And then the final step really came more to the work social impact did on understanding the evaluability of certain investments. We have varying levels of end-line data and information available on our projects. That's something that has shifted a lot at USAID over the past 10 to 15 years. So then it really came down to which countries we were able to work in and to implement one of these evaluations. So it's a little bit more of an art than a science in picking the countries, but we do feel that so far, the 5 we've selected that are either done or ongoing give us a good range of information about our programs. So I hope that answers the question. I'll start directing at Carrie a couple of clarifying questions that came in during the presentation, and then move into some of the broader why questions that many of you have been asking. So the first question, Carrie, can you describe the type of water schemes and water points you saw? Were these hand-dug wells? Were they boreholes, hand pumps, pipe systems? Can you give a sense of what you looked at?
Yes, definitely. So there was a variety. I would say most tended to be either hand-dug wells or spot springs. And there were a few boreholes, there were a few extension systems, but most of them tended to be hand-dug wells, and at least in the areas where we had visited were hand-dug wells and spot springs.
Great. And Carrie, can you clarify your water quality testing that was completed as part of this? Was that done at the water point or at the household?
So that was done at the water point. So we were testing the quality of the water provided by the source and not necessarily measuring water handling and any potential contamination that might result from that.
Great, thank you. And on the water quality point, do you know anything about whether the MWA intervention that was done included regular water quality testing, or what kind of water quality testing it included?
So if the question is during the activity itself, so we do know that all of the water points would have been tested at the time of construction. Post-intervention, though, our understanding is that responsibility shifted to the government / the washcos, and so that kind of speaks to the point I noted earlier, where there was a little bit of disagreement or lack of clarity on whose responsibility it actually was supposed to be. But to our knowledge, the water quality testing under the activity itself was primarily around the time of construction.
Great, thank you. So I think this question was regarding people noting that they used multiple sites for accessing water. What reasons did people give for using those multiple sites?
So on this point of why, unfortunately, we don't have a lot of data, as the evaluation wasn't designed specifically to look at that particular part of the question. However, we speculate based on some of the data that we do have that convenience may be a factor, that just general accessibility and availability of water is likely playing a factor. Unfortunately, though, we aren't able to make any firm conclusions based on the data we have.
Great, thank you. I'm going to move into a series of questions we got regarding the financing. And I think the first piece of this is, was it part of the MWA program to do life cycle costing and to work with the WashCos to determine those life cycle costs?
So on this, unfortunately, we don't have a lot of details on the specific trainings that were provided. We do know that the trainings and approaches with the WashCos varied by IPs, but we don't have access to the specific modules, for instance. So unfortunately, I can't speak to whether that was whether full life cycle costing was a part of that training or not.
Okay, thanks. And do you know anything about whether there was an affordability or a willingness to pay study conducted prior to construction?
Not to my knowledge. So we did ask we asked the communities how the water fees were planned and how they came up with the amounts, and it varied by area. In some cases, they said there was a government standard, and so they just went with the government standard. In other cases, they said it was the community that kind of came together and they decided on what the fee should be. But it did seem to vary.
Great, thanks. There was a question you cited in one of the earlier slides, the statement about whether the water points could provide 20 liters per person per day. And I think the question here from Susan was whether that was considered enough for all household uses. So I know that that number comes from sort of the international standards, but did users actually consider that 20 liters enough?
So when we asked people if they felt they had enough water for all their needs, most of the people we talked to said yes. That they did feel that they were able to access. Now, we didn't specifically ask if they thought that the 20-liter standard was sufficient, which is a slightly different question. We asked questions around if they could access, the 20-liter standard, if they felt overall what they could access was sufficient. But we didn't quite ask the question, as you're posing it there, of whether the standard itself would really be sufficient.
Thanks. So moving now into a lot of the questions that came up as you were presenting some of the answers to these why questions. The first one, your bar charts were showing that based on the inventory data, I think this was the non-MWA-EP water points had better functionality rates, and also the WashCos had higher levels of functioning than the MWA water points in that same zone. Any thoughts from you or your team on why that might be the case? I know, this wasn't a randomized control trial or anything like that, but based on your knowledge, any hypothesis on why that might have occurred?
Sure. So, as you note, it's not an impact evaluation, so we can say with any certainty. One of the additional challenges here is, given the number of implementing partners and given how the approaches differed between those partners, we do suspect that implementation modalities likely played a factor. However, it's difficult to dig more into exactly what aspects of those modalities, if it was, say, the training modules that they were provided with, if they were other aspects of the implementation modalities that would affect that. Unfortunately, we don't have enough information about the training programs and the specific details to dig too far into that potential option, though I do think that is an option. Other potential options could be the various like cultural and just kind of historical experiences that we kind of talked about, for instance, on the ability to collect water fees. That all of those factors are also going to play a factor in kind of longer term sustainability. And unfortunately, though, while we can kind of speculate that some of these factors were likely playing a role, unfortunately, without a full impact evaluation from the beginning of the activity, it is difficult for us to come up with a firm answer to that question, unfortunately.
Yeah, and I'll add that I just think part of continuing to say it wasn't impact evaluation is the fact that the communities MWA worked in were very likely not the same in a lot of important ways as the communities they did not work in. So whereas if you randomized things and you knew that they were intervening in certain areas and the other areas were very similar, you could make that comparison just to the implementation. Here, we don't really have enough information about what the differences were in the areas MWA worked and the areas they didn't. So another question on some of the negative findings on the latrines. Do you have insights into why latrine usage was so low, why they weren't being upgraded, and maybe why those public latrines were completely unused and didn't even exist by this point?
So I'll start with the public latrines. So as I say, the amount of information that was available on those, because it had actually been quite a while since they had fallen into disrepair. Basically, we were told there was only 2 woredas where these were implemented. It was only implemented by one of the partners. And in one of the woredas, they fell into disrepair from what we're told even during the activity. And so shortly after the end of the activity, they were already gone. They'd already been dismantled primarily for firewood, so that the privacy fencing and so forth was actually stolen and used for firewood. In the other woreda, they were a bit more successful in that they did extend past the end of the activity, and they're reported to have actually been replaced once, in which they actually would have wanted to take the slabs from the original ones, but apparently they had been so poorly maintained and cleaned that no one was willing to touch the original slabs in order to move them. And so they reconstructed them, but they didn't use the same types of materials. They didn't use cement. They just used wood. So they weren't nearly as nice, and they too eventually got broken down for firewood. So that's kind of the public latrine side, which I think is a distinct case from the household side. So on the household side, I think it kind of goes back to that that behavior change model of really needing to get to that next step, and that really seemed to be a challenge, moving from kind of base knowledge to action. And I think what we found is that the behavior change modalities implemented under the program, I mean, this was 10 years ago. And so the main types of training were different then, and so things have evolved quite a bit. And I think the methodologies and kind of the very different methodologies that each implementing partner was implementing just weren't quite enough to get over that hump. And I think we've learned that in the sector more broadly, that now we have moved on to different types of approaches. we have moved on in a lot of cases from the fast types of methodologies and more just kind of community education. Because really at the end of the day, as far as we can tell, MWA-EP was primarily around just community education, and that wasn't sufficient in order to get over those hurdles. And I apologize, Liz, was there another aspect? I know there's a couple different aspects to that question. Did I address all of them?
Yeah, I think you did. If not, to whoever asked that question, please feel free to continue typing in the chat if there were aspects of that didn't get answered. Another question is, did the program model include the Regional Water Bureau or the WREDA water offices in designing and citing the interventions? I think this is specific to the sort of water point construction and rehabilitation. And could that have contributed to why there was a difference in the functionality and management on the non-MWA-EP water points versus the MWA conception water points?
Yeah, so in terms of the overall design of the project, as I think the final evaluation from 2008 had noted, the really engagement of these government entities was not perhaps what it could have been. And again, I think this is something that a lesson that's been learned in the sector more broadly, and so I think more recent projects do tend to engage the government entities better. But at the time, though government entities were involved in kind of high-level meetings and ceremonies, their engagement appears to have been less kind of functional and less engagement in, okay, what is the next step after this activity ends? Who's going to be doing the support? What are the different roles and responsibilities? And then specifically to the siting question, I do want to distinguish that and kind of site selection, because when we asked the implementing partners how they had gone about selecting the sites, though responses varied, a number of the IPs did say that they worked with the governments and other key stakeholders in the areas, but mainly around identifying sites where water access was still an issue, where people didn't have water access. But I think that was the main role of engagement, rather than on the wholesale planning of the project.
Great, thank you. So I'm going to tie sort of two questions that came in together. The first is, do you have any information on mobile usage in these communities? Do people in the communities tend to have cell phones? And then the second question, somewhat related to that, is how do you see the role of technology in increasing the sustainability of projects like this? And the examples here are smart hand pumps, mobile water payments, etc.
So certainly. So I mean, as you can imagine, this particular activity coming 10 odd years ago, these weren't really, technology wasn't really something that was used a lot in WASH programming. So I do think that's a newer technology, but so I do want to just recognize that and make sure we have the MWA activity in its proper context. But I do think that certainly those are potential options to look at, and I think this is where our recommendation around looking at the current models, looking at the lessons learned, looking at future potential models that can be tested really comes into play. We didn't want to be prescriptive around saying this is the particular approach that future programs should take, just because we want to recognize that learning is ongoing. And so we're always going to be learning more about what does work, what works best, what are the aspects that don't work. And so I would say that I think the mobile technology has a lot of promise, but we should be continuing to learn about how best to use that and how best to leverage mobile usage to really enhance that, enhance those outcomes.
Great, thank you. So more broadly, Carrie, you read the end-line evaluation of this program as part of the assessment, and were any of these negative findings apparent, I guess, either during program implementation or as part of that end-line evaluation? Was there a precursor that we could have seen to some of these negative findings?
So I think kind of the two key points that we pulled out on the hygiene and sanitation education side, I think that was a oppression finding, and I do think we saw that playing out in the results that we found. I think similarly the government engagement piece and making sure that the institutional structures were in place and really ready to take up their role post-implementation, those two weaknesses that were noted in that final evaluation, we did see play out. Yeah, so I do think those were oppression findings.
Great, thank you. I guess another spin on that question was, were there any positive findings for enhancing sustainability? So we know that budget is always limited, but there are examples out in the world of how a limited budget has been well used, and same thing with staff. There are lots of cases of limited staff, but that the available staff are highly motivated and doing a wonderful job. So was there anything you could pull out of this evaluation that might be seen as sort of a positive lesson on sustainability?
Sure. I mean, certainly any of these things, they kind of point to the cases where it did work better. So in the cases where the washcos were able to collect fees, even the washcos that they didn't feel like they had enough money to do everything, but in the data that we have, we do see that those who could at least collect some fees were doing better than those who couldn't collect at all. And so that being able to collect at least some water fees is definitely a benefit to the washco. And so, I mean, from that, I would say, even if we aren't able to do all life cycle costs, at least being able to cover some of them obviously is beneficial. I mean, similarly, in talking to people about the barriers that do exist, and learning from what they are doing to kind of surmount some of those. So whether it's building on existing projects that they have and they can kind of leverage those projects to extend their reach, speaking to kind of the water offices and so forth. And so I mean, yes, there are definitely positives that we can take from this in terms of those cases where functionality was better, where the things did work out better.
Thanks, Carrie. Can you, I guess, quickly comment on why this evaluation did not look at the institutional wash, for example, the wash in schools aspects of the program?
Sure. So that was a decision made during the design phase, just based on the available resources and time that was available for this evaluation, and where there was a desire for learning. And so in consultation with the mission and with the E3 office, just looking at where most learning was desired. And so the thought was that we might be able to learn a bit more than we currently know from looking at these other aspects, just given the limited resources that we wouldn't be able to look at everything.
Great, thank you. And I'll just add, there's a question also on that about whether we plan to look more closely at that dimension in the future. Within this program, no. This is sort of the only ex-post evaluation we intend to do for MWA-EP. In terms of whether any future evaluations include that component, it might, but it a little bit depends, again, on the final country selection, what the interventions were, and what we end up prioritizing for learning. Unfortunately, with only 6 evaluations and limited resources, we can't address, I think, every aspect to the degree we'd like to. And so, we're trying to get as complete of a picture as possible of our WASH interventions here, but, it's likely there will still be types of interventions out there that we haven't had the opportunity to evaluate in this way. So Carrie, we had a question from Tree at USAID Indonesia asking for a comment on how the evaluation team got insights from USAID Ethiopia colleagues about the MWA project implementation. So were you able to get some insights about the implementation and aspects that might have strengthened or challenged sustainability?
So we did definitely discuss the evaluation and our key research areas with folks at the mission. I will say one of the challenges we faced is that much of the staff have turned over since the time of this activity, given how long it's been since then. And so we weren't able to talk to anyone that had been directly involved in the activity. And so our discussions more centered around just kind of general challenges within Ethiopia, things that are kind of coming up within the more current work, and so they were less focused on the activity itself. So that was one challenge that we faced.
Thank you. So I want to get to a couple questions here that are, I think, a bit more directed at USAID than at the evaluation team about where we go from here. So the first one of these was specifically about fees and knowing that there is a reality of poverty. There is also unwillingness to pay among those that are maybe able to. And so what is our way forward here? And then more broadly, there's a comment that these results are reflective of many evaluations, both from Ethiopia and elsewhere. And what is USAID going to do in response? So I think those are great questions. Those are really where we're aiming to go from this evaluation series. I think Susan's comment was right that these findings weren't shocking to us. There's been quite a bit of study done on water point failures. There's also recently been some literature coming out on the community management model and some of the weaknesses in that model. So I think these findings of our own program are quite well aligned with what others in this sector are talking about. I think the first point to make is that some things have changed already since this project ended in 2009. I think Carrie spoke at length about behavior change approaches, and I think that's one particular area where a lot has changed since sort of the era of direct health promotion, and even going beyond sort of CLTS alone, behavior change alone, and coupling that with some of the market approaches and the governance approaches. I think that's a shift we're already in the midst of to varying degrees, but an area we need to continue to work on, and a place where we need to continue kind of studying what types of behavior change interventions lead to really sustained behaviors, what creates habits, what creates behavior change without a huge cognitive burden. And that's an area USAID is sort of actively investing in learning on and beginning to incorporate into our programs. In terms of sort of the water side of this evaluation, we're working with a lot of our missions to come up with models that go beyond this kind of community management. I'd say that already our programs are taking the finding about, lack of engagement of the higher level governments to heart and have incorporated that. But moving even beyond that to think about what the models might be beyond just community management with a volunteer committee is something we're committed to doing, and we're working closely with missions and with certain implementers to test new ways of doing that. And this post-project evaluation series is one component of our work on understanding sustainability. We also have the Sustainable Wash Systems Learning Partnership that is focused on strengthening local systems to deliver services. We are also working to study some of the new technologies around like remote sensing of water points for better servicing, looking at different payment models. So all of that is happening, and I think it'll be a gradual shift, but a definite shift in the way our programs target interventions and what types of things we do. So hopefully that gives a taste of what we're doing to address the findings. We also are really looking forward to the synthesis report when all 6 of these are done, to try to draw out some themes across different types of interventions and across different countries to better understand what kind of guidance we should be giving. So there were a final 2 questions. One was about how satisfied USAID is with these findings, and I think obviously we are disappointed that there wasn't more sustainability seen. But like I said before, it's not shocking given some of the other findings around water point maintenance and knowing the challenges of operations and maintenance in Ethiopia in general. But we do think that this gives us a really robust understanding of some of the reasons why and some of the areas we need to be working on in the future. And the last question, sort of meta about the series itself, is how often or what should be the frequency for this type of analysis. And I don't think we have a clear answer yet. We know it's important and something that we should continue to do and to consider with our projects. There's also a lot of challenges in implementing these. I think going back where people may have moved on, where records might be incomplete, where you're trying to find places that haven't had so much follow-on intervention that it's unclear what the project did and what others did, all create a lot of challenges. And so I don't think this is something we would start to do with every single project globally. But it is something that's been important to our learning, and I think something we'll keep considering how we address in the future. Carrie, do you have any final thoughts or closing remarks on this?
Maybe just a quick note to thank everyone for participating. Hopefully you've been able to download the files, both the webinar slides as well as the executive summary. And yeah, we just want to thank everyone for their participation this morning.
Great. Thank you so much, Carrie, for the presentation. And thanks everyone for coming. Oliver in the chat window has just put a link to where you can find resources on the ExPost evaluation series. If you weren't able for any reason to download the attachments here, those will be on the website in the next week or so. I believe this recording will also be available there. Look out for the full final report and brief for this evaluation, which will be posted to that link. And stay tuned for another email inviting you to hear findings from the Indonesia ExPost evaluation next month. Thank you all.